think that eyelid surgery is one of the most important things that we do because the eyes signal so much to the world about how we feel about ourselves. But it's very important to avoid unnatural outcomes. It all starts with a very careful evaluation, not just of the eyelid structure, but also the function of the eyelid, because remember, these eyelids are ultimately there to protect our eyeball. What are the keys to avoiding these unnatural results? Well, it's not a contest to see how much fat you can take out. Yes, sometimes we remove fat or reposition it in the lower eyelids and maybe a little bit in the inner corner of the upper eyelid. But generally speaking, the old style upper blepharoplasty and lower blepharoplasty where you hollow out the eyes, what does that do? It makes a socket eye. Well, where do you see that? You see that in super old people or someone who's super malnourished. So how's that supposed to be a young eye? It's not a young eye at all. So it all comes down to a very careful assessment. You always want to talk to the patient about their eye health. And the other thing that I like to talk about is thinking about, the frame of the picture, if you will. Because sometimes a lot of the changes that appear to occur in the eyelids are actually related to changes in surrounding structures. For example, as we age, especially if we're athletic and trim, we drop out our fat in the upper cheek and we unmask certain things. So sometimes it's really a matter of adding volume to the upper cheek with a fat transfer or to the temple. Thinking about the frame, same thing with the brows. Sometimes the brows come down, so we really need to reposition that brow if we're really going to get a result. So we love to look at old pictures of people because that shows us their natural facial structure. But when it's done with subtlety and attention to detail, the eyelid operations can be one of the best things we do for our patients.